All right, welcome back. Today we're diving into an element that is absolutely essential for life, but it can also be one of the most lethal substances out there if the concentration is just slightly off. We are talking about potassium, what I like to call the heart's ultimate double-edged sword.
So let me kick things off with a question for you. What's the one single number your heart absolutely cannot live without? And no, it's not your cholesterol, it's not your blood pressure. It's a number that lives on a razor-thin margin between perfect function and, well, fatal failure.
Okay, so to really get this, we've got to talk about the heart's super delicate electrical balance. See, potassium is the main player here. Its whole job is to conduct every single heartbeat by maintaining this perfect electrical charge across all of our cells.
So, here it is. This is the number. Your body is working around the clock, non-stop, to keep your blood potassium level between 3.5 and 5.5. Just look at how incredibly narrow that window is. A shift of just 1 or 2 points in either direction, that's a full-blown medical emergency.
And you know, when that delicate balance gets thrown off, we land in one of two very dangerous spots. If potassium drops too low, we call it hypokalemia. If it skyrockets, it's hyperkalemia. Now, both can seriously mess with the heart's rhythm, but they do it in totally different, very specific ways.
Okay, let's dive into our first case file, hyperkalemia, the too much problem. This is when the body is just swimming in excess potassium, and you better believe the heart is the very first organ to sound the alarm.
So, you might be asking, where does all this extra potassium even come from? Well, a lot of the time it's because the kidneys, which are supposed to filter it out, have started to fail. It can also be from certain medications, or in some really intense situations like severe burns, when massive tissue damage unleashes this flood of potassium from inside the cells right into the bloodstream.
And this is where it gets really fascinating. The heart doesn't just give up. It's smarter than that. It starts sending out these super clear, escalating warning signs that we can actually see on an ECG.
Okay, so the first chapter of this scary story begins with the T waves. In mild hyperkalemia, the T waves, which represent the heart's recharging phase, get weirdly tall and spiky. They look almost like a tent. This is the first red flag, the classic sign we look for. Now, if the potassium keeps creeping up, the electrical signals themselves start to get sluggish. The message from the heart's pacemaker gets delayed, and we see that as a longer PR interval. Then the main contraction signal, the QRS complex, starts to stretch out, getting wider and wider. It's a sign the ventricles are really struggling to fire.
And if nobody steps in, you get this, the most terrifying pattern you can see on an ECG, the sine wave. The QRS gets so wide, it just melts into the T wave, creating this smooth, rolling wave. Yeah, this isn't a warning anymore. This is the heart basically screaming that a cardiac arrest is just moments away.
So how on earth do you pull a patient back from the brink? The emergency response is actually this beautiful, logical three-step dance. Step 1, shield the heart. Step 2, get that potassium out of the bloodstream and hide it back in the cells. And Step 3, get it out of the body completely.
Okay, and this is probably the single most important thing to remember in this whole situation. The very first move isn't actually to lower the potassium. It's to give IV calcium. Think of calcium like a shield for the heart cells. It stabilizes them and protects them from the poison of high potassium. It doesn't fix the problem, but it buys you precious time.
Now, to keep all of this straight in a high-stress moment, clinicians use this fantastic mnemonic, C big Ka drop. It covers the whole shebang: calcium to protect the heart, then beta agonists, insulin, and glucose to shift potassium into the cells, and then K-oxalate or diuretics to finally get it out of the body.
All right, let's flip the coin and look at the other side of the spectrum. What happens when there's too little potassium? This is hypokalemia. And while the signs here can be a little sneakier, trust me, it's just as dangerous.
So, the too little problem, it's usually about losing way too much. We're talking about things like severe diarrhea or vomiting, or even using certain diuretics, those water pills that cause the body to flush out way more potassium than it should.
And you guessed it, the ECG tells a completely different story here. Instead of those tall, spiky T waves, they start to flatten out or even flip upside down. And then this mysterious little bump might show up right after it. We call that a U wave. All these changes make the heart really irritable and unstable, putting it at risk for a deadly, twisting rhythm called torsades de pointes.
So you'd think the fix is easy, right? Just give more potassium. But how you give it is everything. IV potassium has to be given slowly, like dripped in over an hour or more.
Giving it as a rapid IV push is one of the deadliest mistakes you can make because you can instantly cause the very cardiac arrest you're trying to prevent.
So, at the end of the day, it all boils down to this. You have to be able to tell these two bad guys apart when the pressure is on. So let's do a quick head-to-head to really lock in the differences.
Okay, here's the ultimate cheat sheet. For hyperkalemia, that's too much potassium, you're looking for tall, peaked T waves and a wide QRS. Your first move, stabilize the heart with calcium. For hypokalemia, too little potassium, you're looking for flat T waves and those weird U waves. The priority, slowly replace the potassium.
Look, if you walk away with just one thing, let it be this super simple rule. High K means high T waves. Low K means low T waves, and maybe that little U wave tagging along. It's just a dead simple visual connection between the level in the blood and the picture on the screen.
You know, the patterns seem so clear when we're looking at them like this, right? But in the middle of a chaotic emergency, when the alarms are blaring and the pressure is on, the difference between a peaked T wave and a flat one is literally the difference between life and death. The real question is, with everything on the line, could you spot that critical difference?